Hello, and welcome to Everyday Simple Somatics, a podcast dedicated to helping you find healing through your body's natural wisdom. I'm Dr. Christine Baker, and I'll be your host. Okay, I want you to imagine this. You have been working towards something really important for months. Maybe it's like a promotion at work or a relationship that seemed to be heading somewhere special, or maybe even a special trip that you've been saving up for. And you are like, I'm at the end of this road. I can see the finish line. It's right there, until suddenly it doesn't happen. So maybe the promotion goes to someone else. Maybe there's a storm that cancels your beach vacation. Maybe the relationship fizzles out. Now I want you to just notice what happens inside as I describe that pretend scenario. Maybe it feels like hollow. Maybe it feels like a dropping, like a lot of people describe it like the floor is being pulled out from under me. Maybe it feels like a stomach ache or a wave of heaviness. For so many people that experience disappointment, those sensations, that imprint left on the body from disappointment can stick around. It can kind of become this constriction or this burden that our body carries around for days, months, even maybe years. And I see it all the time in my practice. Person who's been disappointed so many times that they stop trying, or the achiever who can't celebrate successes because they're still carrying around old disappointments, or the partner who's afraid to hope in the relationship because the disappointment from the past has hurt so much. And I think what so many people don't recognize, and this is why I wanted to do this episode, is that disappointment is not just an emotion. It's not just a memory that you're holding in your mind. It is a physical experience that is living on in your body. And that's why I believe your body is the key to moving forward. For those of you that don't know me, I'm Dr. Christine Baker. I'm a licensed professional counselor, and I've been a trauma therapist for over 13 years. I am also a somatic experiencing practitioner, which just means that I'm a person that believes strongly that trauma is not just something we experience, but it is the imprint left by that experience on our body. And therefore, our body is vital in the trauma recovery process or the mental health journey, which was actually the catalyst for this podcast. I really wanted to create an accessible resource that gave people baby steps at bringing their body into their mental health journey. You know, this is a free resource. This is a short resource. I try to keep these episodes like 10 or 15 minutes because my hope is that people can just look at the list of episodes, find their symptoms, grab whatever that somatic skill is, and start a regulation rhythm in their lives to help support their nervous system around the ways that it carries their history. So if that sounds like something that you might be interested in, I'd love to invite you to like or subscribe to this podcast on whatever platform you are watching or listening to it. All of those little clicks really do help other people find these resources as well. So before we dive into today's practice, I'd love to just share a little bit of the science behind why somatic approaches matter so much, specifically for disappointment. I mean, you guys know I believe somatic approaches matter for everything, but we're going to talk about disappointment today. So as I've said so many times, Dr. Peter Levine, founder of Somatic Experiencing, teaches us that emotions like disappointment are not just mental states, but they're physical experiences, physiological symptoms that are stored in our bodies. And when disappointment hits, our nervous system often responds with a shutdown or collapse response. This is especially true if we have experienced significant disappointments in childhood that weren't properly supported afterwards. And so the practice that I want to share with you today actually helps complete that physiological cycle that disappointment activates. And so rather than suppressing these feelings or getting stuck in like a state of rumination, we're going to use the body's natural capacity to process, to move through the emotional state. So let me tell you what the practice is going to be for today, and then we will actually do it together. Okay. So for this practice, there is about 7 steps. So we've got a few steps in this one today. So the first one, we're just going to kind of ground, check in with our body, and then we're going to bring up a memory related to disappointment and just notice what sensations come up. And so we're going to actually name those sensations. Is it cold? Is it hot? Is it still? Is it moving? Is it empty? Is it constricted? Whatever it is, tracking those symptoms, right? And then this is the kind of the intervention part. Once you've kind of located, okay, here's what disappointment feels like. Here's how it is in my body. We're going to breathe into those places. Okay, so we're going to imagine breath just flowing as we breathe in. It like moves into that spot, whatever it is. And then as we breathe out, the exhale just takes all the disappointment with it. And this isn't like magical, right? I don't actually believe that the breath is taking the disappointment out of your body. What I do believe, though, is that imagery of resource and then allowing movement out actually is going to show your body this doesn't have to stay stuck. Right. And so we'll do that for a moment. And then we're going to give some space to just allow for any movement that wants to happen, whether that be, maybe there's a stretch that wants to happen or a shaking off or a push outward with your hands, whatever it is. We're just going to give our body some space to have any kind of physical movement it wants to after we have resourced that spot that holds the disappointment. And then we're going to just offer some final support like to that place. So say it's your chest, maybe place a hand on your chest and just offer some compassionate words. I'm here with you. This too shall pass. I can hear the sadness you feel, and that combination of touch and compassionate self-talk really activates like your body's natural caregiving response. And so that is going to help activate that ventral vagal system. And finally, we'll just close by checking in with how we feel at the end of all of that, the integration of the work. So if all of that sounds good, I'd love to invite you to just get comfortable in your chair or standing, however you are in space right now. And I just like to invite you to take a couple breaths, just natural breaths, nothing fancy, and just notice the support underneath you, whether it be the floor under your feet, chair under your seat, or maybe your spine that holds you up. And just taking in that support, holding gratitude for it, noticing the stability of it. And then whenever you're ready, I'd love to invite you to just consider a memory where you felt some disappointment, whether it be in a job situation, a relationship, goal that you had set. And as you hold that memory, I want you to just notice what happens. Noticing like a sensation of like, and I may have picked a memory that was too big, but of like my kind of like chest and heart area, just feeling like it like is collapsing forward and just like pouring out. And so just notice what happens for you, noticing if there's tightness or constriction, more of a flow feeling, noticing the temperature, where in your body it is. And I just want to offer that we be curious about those sensations, not try to change them, just give them a little space. And then whenever you're ready, I want to invite you to breathe into those sensations. And so you're just directing the inhale towards that area of discomfort, just to like allow for some movement where there may be stuckness or allow for some support. I love to think of breath as a resource for the body. And so just imagining that that breath is just flowing to those places of disappointment to resource those places. And I want you to take maybe 5 or 6 slow, deep breaths into that area. And the inhale just resources that space, and the exhale just allows for any movement that might need to happen. Yeah, just kind of seeing what you noticed. I noticed like a lot of downcast, like with even my vision felt very downcast. And as I continued the breath, my eyes kind of naturally came up to more of a like orienting at eye level, which was nice. And then I started to just feel like a pain in my chest. And so it was almost like now that I was more present, I could be with the pain. And so I want you to just notice if there's any desire for movement right now. Maybe your body wants to stand up. Maybe your body wants to sigh or stretch or shake it off or push outwards. These are like natural completion actions that your body may want to do. And I just want to give you permission to follow those subtle impulses. As you guys may have noticed who are watching on YouTube, I noticed for me, I just felt like I wanted to support that place that was holding the pain. And so I just placed a hand there. So just do whatever you need to do in this moment. And after you've completed that movement, and if you need more time, of course, you can pause the podcast. We're going to offer just that self touch with compassion. And so I'm already doing self touch. So I'm just going to add a second hand just to offer that extra support. And if it feels okay for you, you could place a hand on the area of your body that you've been focusing on. Or if that feels like too much, you may even just allow the hand to kind of levitate above the body, or even just imagine that a hand's touching that place, whatever feels right for you. And as you do that, I just want you to take in the holding. Disappointment it's a version of grief, right? And it may not get the same attention that grief gets because it's kind of the loss of a dream or an expectation, but it's still grief and it still needs to be held. And so I want you to just take in the holding that you're physically offering your body. And if it feels right, you could say out loud, I'm here with you. You're not alone with this. As you say whatever words feel right for you, I'd love for you to just take a couple of moments as we close, just to notice how your body feels now when you think about that same memory. Just noticing if anything shifted, have any of the sensations changed in quality, intensity, location, and whatever's there is fine. We're just being curious about it. The goal is not to make disappointment go away, but just to help your body process it. I think what's coming up for me, I'm aware that I don't have that same kind of like collapsy. It really just felt like a kind of explosion of everything that was in my chest down into the ground. And I think now I'm just really aware of the holding. I almost got emotional when I was saying that bit to y'all about the holding. It just felt really like exactly what I needed. So I'm aware of that, grateful for that. So pause if you need more time with this. I'd love to just take a second and talk about how you might use this in your everyday life. Whatever kind of little practice you did, I think this is something that you could do for 30 seconds when you feel that first sting of disappointment, kind of locating it in your body, offering it support, and kind of help it before it starts to get stuck in there. I think you could also do something like this before bed. So maybe giving your body space to process any disappointments from your day so that they don't like disrupt your sleep or linger into tomorrow. You could also even do this before getting an answer. So like if you're up for a promotion, before you go in for that meeting, support your body with this skill. And I just, as we're getting ready to kind of wrap up, just a reminder that processing disappointment somatically doesn't mean you won't feel it. Even I just shared, I very clearly was feeling a lot there. It just means that you'll move through it more efficiently like preventing it from becoming this stuck place in your body. So I hope that this was helpful. That is all I have for today. I'd love to take a second and just share with you about what we're going to be talking about in next week's episode, which is going to be cyclical arguments. So I know that we all have those people in our lives that we tend to have the same argument with over and over and over again. I'm going to talk about what is happening in your nervous system when that happens and what you might do with that person to help you guys get out of that rut. So if today's episode was helpful, or if that next episode sounds helpful to you, I'd like to invite you to like and subscribe to this podcast on whatever platform you are watching or listening. And if you'd like to dig in deeper to these somatic concepts and really create like a personalized regulation rhythm in your life, I'd love to invite you to the Somatic Wellness Collective. This is my monthly learning community. We have on-demand classes, we have live classes, we have a community forum where we're talking about all things somatic. And so I would love to invite you to consider joining us there. I've got all the details about that in the show notes. And so as we close, remember, your body has innate wisdom. We just have to learn how to listen to it. And that's what I'm here for. I'll see you next time.